Thank you, Michael. This is a time where an opportunity for the public have up to 10 minutes for any comments, but also at the end of the meeting is a second chance as well. So if you would like to say something from the Planning Council, please sign in on the board now and also at the end of the meeting if you have a second chance. So is there any other? I just need the board to see who signed in. Just Michael, okay.
It's okay, can I sit at the table just while I speak?
Sure, just one moment. Marie Hayes, can you just introduce yourself for the record?
Marie Hayes, 7 House, Ryan White Park D, Conflict for Outpatient Medical.
Thank you. Okay, Michael.
Good morning. I just wanted to, I came here this morning, so there's been a lot of discussion over reauthorization of the Ryan White Care Act in the community. I'm not sure if everybody knew that last week there was originally a Ryan White, or AIDS Healthcare Foundation had sponsored a Ryan White reauthorization town hall that was predominantly, I would say, in the white gay community and not necessarily in the overall inclusive Broward HIV/AIDS community. You know, about a month ago or 2 months ago, as only one stakeholder in this community, AIDS Healthcare Foundation had approached Fort Lauderdale City Commissioner to introduce a resolution which weighed in solely on the issue of Ryan White reauthorization, when sadly the Fort Lauderdale City Commission serves as the grantee for the Housing Opportunities for Persons with AIDS grant, which we all understand, I believe, at this table, that housing serves as the foundation to ensure that somebody accesses and retains in care. And unfortunately, that is not the position of AIDS Healthcare Foundation, where the representative stated that the program is abused by consumers regularly, and they don't understand the use of the program, nor do they engage in it or believe in the HOPWA program. And I found that rather startling when you consider the organization is supposed to be looking into medical care and how best to achieve an individual's health outcomes for a person living with HIV/AIDS. The resolution was pulled from the county commission by the sponsoring commissioner when I opposed the item, and basically stated that they really are going down a path that they should not go. You know, we have a long process and history in this community of collaboration and input from multiple stakeholders. After all, the table that I'm right now sitting at temporarily is one that was established by Congress to ensure that there was community participation in the dialogue around HIV/AIDS and how best to ensure that individuals living with HIV/AIDS who are uninsured have the opportunity to access, retain medical care, and live a happier and longer life in living with the virus. Thankfully, the virus has changed over the years, or modern medicine has improved the way in which it goes about. Now, some of the things that I have learned over the time is, you know, around the nation, AIDS Healthcare Foundation has also been unethically engaging their client population by advising them that the Ryan White Care Act terminates. Now, while the legislation that authorizes the CARE Act does expire on Sunday, the Ryan White Care Act will continue as long as Congress continues to fund it. Unlike previous years, the legislation does not have a sunset provision. You know, a work group was established through SFAN. I'm not sure if any of the Planning Council members actually had an opportunity or an invitation to participate in that dialogue, which I think that Part A has a far greater stake in this than Part B, a local Part B consortium would. And certainly it raises concerns with me. I don't know if this Planning Council was also invited to participate in engaging the community in a healthy, robust dialogue to ensure that we had a balanced conversation on the issue of reauthorization. We all know that this weekend Congress will be probably shutting down government. And we all know that, you know, a lot of people will be having difficulty. There will be some of our clients who will also go hungry. And the council may want to look at putting emergency provision in place to expand food bank services even to ensure those who are not going to be able to get food stamps are still able to eat and take their medications. And I think this council needs to maybe take an emergency action on that one step, which I would recommend. Secondly, the County Commission last month had a resolution without consulting the Part A program, or Ryan White, more pointedly, Planning Council, to really receive input on what a resolution would be to Congress on reauthorization. You know, several years ago, I pulled the federal legislative packet from the County Commission's agenda and asked that advisories of the Commission that are established by the Commission and appointed by the Commission be given the opportunity to weigh in on very important policy issues. That has not been the case, to my knowledge, in this resolution. On Tuesday, Commissioner Tim Ryan, who does not serve on the HIV Planning Council, which I believe Commissioner Gail Holness does, is bringing forward once again a resolution at the urging of County Commissioner, Fort Lauderdale City Commissioner Dean Trentalis at AIDS Healthcare Foundation's urging. It is a revised document, which was for the purpose. It was not necessarily a document with 100% confidence in the revisions. It was a document that was clearly stated on top that it was consensus to ensure that the Fort Lauderdale City Commission took a greater priority and actually spoke and included discussion relating to HOPWA, which Commissioner Dean Trentalis was very eagerly not trying to mention. And I don't know if that's because on October 14th, Broward House has to go before the Fort Lauderdale Community Services Board to respond to a $1.4 million audit, and that is a board that Commissioner Trentalis served on. So I don't know if politics is at play, and if politics is overplaying the situation of public policy that engages the very way that our consumers receive their care. We have a history of asking for input. We have a history of ensuring that there is dialogue. And I find that at a time in 2013 when we're trying to reach a generation that doesn't know AIDS, I find this to be highly irregular and highly offensive to the processes that have long standed in place since 1991. You know, I believe that you have a motion that you'll be entertaining later today relating to reauthorization. My recommendation, and I'll be here for that conversation, is that the Planning Council table that motion and send a motion to, or recommendation to the County Commission, urging them to hold off on any consideration of resolutions until the Planning Council has had the opportunity to actually put on a town hall, to invite consumer input, not to have it hosted necessarily in predominantly the gay ghetto, put it in a more neutral territory, perhaps the library or the County Commission chambers even, and educate people on the issues at hand, and educate them on the dangers of opening up this can of worms during such a volatile time as we're seeing right now in Congress during the shutting down of government. And then at that time, I think it would be suitable for next month's Planning Council meeting, or prior to that this Planning Council would then establish a work group today that would then formulate recommendations for this council to consider, and then send its recommendation for the County Commission for appropriate action. Nothing is going to happen in Congress prior to January 1, 2014 on any issue other than maybe immigration with possible some debate. There may be some other debate on some other issues, but I think Congress, and Kareem Murphy, who's on the phone, can probably advise you of what Congress's work schedule might look like. And we all know, I think they take 3 or 4 months total vacation, and we'll get paid even then while government is shut down. But I really, I have taken the effort to ensure that this was not something personal. I have, this is a program that I receive that helps pay for my HIV medications through the ADAP Premium Plus program.
1 minute.
And what I'd like to do is make sure that a few weeks ago, I circulated several documents I sent to the Planning Council. I don't know how many people have read these documents from national advocacy groups weighing in on their opinions. And I would hope that staff would have shared these with Planning Council members so that you could be better informed. And if not, I will lend these to staff so they could photocopy these to you in the meantime and circulate these documents to you. There are additional documents in which I can have. I will be making available all my communications with Commissioner Trentalis, advising him on this issue, where it has been, sadly, one where he has decided that he will side just with AIDS Healthcare Foundation a representative who he appointed to the Community Services Board, a representative who's also stated that housing is not his issue. I find that offensive to PWAs. I find the leadership of Dean Trentalis to be one that is counterproductive to HIV/AIDS policy, and I ask for this council to take this under new business or at an appropriate time to take the action to ensure that genuine leadership on this issue is urged by this council of the County Commission. Thank you.
Thank you, Michael. I'd like just to remind everyone, because it's been a while since we actually had someone that came in front of us for the public comment. And so we encourage folks to come forward, and this time is there. It's not a time for us to respond back to the speaker. And so there are issues that Michael brought forward that will come up in our agenda, so there's an opportunity kind of then as well. Also, I'd like to remind members that the speaker can name providers. We, as Planning Council, do not. Okay, so that's kind of leeway that we gave for that. As far as the material that Michael, I'm going to ask that we hold off on that till later. And we'll go.
Mr. Chair, can I ask so that in the meantime staff prepare the documents so that members of the Planning Council, if they are deliberating the issue, can have the information available for reference?
If we have staff,
they're unbiased opinions necessarily from national groups, not my opinions.
Okay. Okay. If during the meeting, if they have the chance to run it off, that's fine. If they're available, that's more than fine. But I just don't want papers being passed out during the meeting.
Can you ask people that didn't already get it? Because I'm sure most of us got it by email several times. It went around the internet like a lot. So I think Will might be the only person here that didn't already receive the emails with all the attachments.
Does any? Okay, then.
You can get it.
No, I didn't get it either.
So can we?
For the sake of the discussion.
Session, can we make 5 copies, please? Okay. Okay. Rick?
Can I just ask, so where in the agenda, can you just point me to the place that
Sure.
this content can...
It'll come up in twice, a little bit, and just hopefully with Mr. Murphy. He'll give us an update, and then also under 21, discussion item number 21. We're after priorities.
Thank you, sorry.
Okay. So, I think they were about making a copy. So I'd like to remind the public there is a second opportunity at the end of the meeting, and all you need to do is put your name on the board, and we'll go back to the public record, and please remind me of that. Mr. Murphy, sorry to keep you waiting. Thank you for your patience. You're up. You're up. Thank you.
Can you hear me?
Yes, we can hear you.
Okay, wonderful. Well, thanks for the opportunity to talk with you today. There's a written report that I submitted earlier this week, so I hope that you've had access to that. But I'll just give you a top-line overview, and then since the subject of reauthorization's come up, I'll just speak to that pretty briefly. But I'm sure as anyone who's had access to newspapers and what's going on in Washington, to be polite, it's kind of a complete mess right now over the appropriations process. So the spending authority for the federal government ends on the 30th on Monday night, and there's no actual plan, agreement in place between the House and the Senate on how to proceed. They've been volleying back and forth. Essentially, the big controversy is over the insistence from the House that programs under the Affordable Care Act be defunded as part of a continuing resolution. So the continuing resolution would keep the government funded on a temporary basis. The initial plan was to keep it funded on a short-term basis through the middle of December, and then they would decide on what to do for the rest of the year. There's a new plan in place that would essentially extend federal government programs for about a month and a half. So we're talking about middle, end of October, or possibly the beginning of November for that. And then there's the other issues, about the debt ceiling limit. So the government has almost reached its borrowing capacity, and Congress has to essentially say the federal government can borrow some more. So there's some partisan negotiations back and forth, or partisan divisions, and negotiations between the House and the Senate on that. My prediction right now is that there will probably be a short-term, what we call a clean, continuing resolution that will keep the government funded for at least about a month and a half, and they would reach a long-term agreement sometime after Thanksgiving. and it's kind of anyone's prediction right now we'll have it on the debt ceiling issue. Those impact funding decisions. So if the government is funded through the end of December, for instance, federal programs, including Ryan White, will operate as normal. And then kind of my prediction right now in terms of what's going to go on for the rest of the year is that they will probably wind up doing yet another so-called clean CR for the year. So they're positioned now, as we sit here now, to do a long-term continuing resolution that will keep all government programs funded at the current level. There may be some tweaking toward the some tinkling around the issues around with that. But that's where we stand right now. That's kind of the big picture when it comes to the federal funding question and what's going to happen with that. Earlier this summer, and this was in one of my previous reports, there was a bill to reauthorize the Ryan White program. If you recall, in the beginning of the year, the White House's 2014 budget did not call for specific reauthorization of Ryan White, but did cite the lack of a sunset provision in the last reauthorization, so that essentially, as Michael said before, if the government funds all programs, Ryan White is included in that. So it does not die, it does not end. It just, Congress just needs to make sure that it funds. It's essentially a program that sits on its shelf and doesn't do anything until there's actually funding attached to it. And the Senate put money in, actually increased a little bit of funding. The President's budget request included additional funding. The only question we had there was what the House was going to do with that. But again, if they do a clean continuing resolution, I won't quite use the word safe, but Ryan White should not be negatively impacted by that process. You know, the kind of question that's come up, at least so far as I've been made aware of it, about the importance of pushing reauthorization. You know, from where I sit, and again, I'm not a community stakeholder there. I'm just providing advice from Washington here. There's sufficient support at the federal level for this program and for funding for it. I do not think that the funding, baseline funding for Ryan White is in jeopardy right now, and I think there's sufficient support to make sure that that remains the case. I think that the biggest opportunity, if there is going to be an advocacy campaign, is really about the bigger questions about adequate funding. And I think there's a way to create an advocacy strategy that has a better chance of having a positive impact if the fight is really about how much and not whether it's there or not. The question of whether it's there or not, I think, is relatively settled. You know, there's a question that we've been talking about earlier about the status of the HOPWA office within HUD, the U.S. Department of Housing and Urban Development. That's at the discretion of the White House and the administration and Secretary Donovan. I think with some strong advocacy, that might be an area if there's a need for additional advocacy, we may focus there. So I guess the message I'm trying to provide is that if there's going to be a strong engagement from people living with AIDS, from stakeholders, from people living with HIV, from elected officials, it's best focused in areas where you have the best chance of success. I just want to be sure that I'm providing you with information so you can make that decision on your own. And finally, just in closing, there was a series of briefings last week around the subject, kind of broad subject matter of HIV and aging. And fortunately, your Senator Nelson, chairs the Senate Aging Committee and was instrumental in getting the first ever congressional hearing on HIV and aging within the Senate Aging Committee. And that there were a lot of additional congressional briefings, but there was an official Senate-sponsored hearing last week that went very well. And hopefully we'll continue to push that subject and make sure that issues of aging are not just about kind of stereotypes of Medicare and Medicaid, but include the specific concerns of people living with HIV. So that's it for me. For a picture from Washington, I'm happy to answer any questions or provide more information if you'd like.
Is there any questions? We're going to have a motion that's coming forward from executive. And this is an opportunity to clarify anything that might be confusing, or I just want to make sure it's clear why we have Mr. Murphy here about the CARE Act. And it's an opportunity to ask a question now to make sure we're all clear as members, because this motion will be coming forward in a discussion. So, Rick?
Yeah, can I just we'll ask Kareem if you could either reinforce or clarify for us that, you know, we talked a lot about the fact that it will continue because it'll be appropriated. I think it's important to also make note of why we think it's probably not a good time to push for reauthorization, not only around the appropriations issue, but because of what we could end up seeing as a changed bill that would not be necessarily in our best interest, because you certainly know the process better than us, but as soon as it goes on the table, then everything gets to go up for reconsideration, so to speak. And I think that's the fear of most of the national advocacy groups, is that this is not a good time on the Hill to be dissecting existing bills. Is that a fair analogy or assessment?
Yeah, I would largely agree with that. I think the fight over the Affordable Care Act is that's the center of the storm, and trying to get a bill considered as part of, in that context can be highly problematic. There is, this could, I think you may have used the term backfire. This could backfire in a very harmful way. And that's not to say, I want to emphasize the South Florida delegation is 100% on board with the future of this program. But there's a practical matter that this is a very difficult time for healthcare and for healthcare legislation, and the die has been cast, and and I'll be very careful because I know this is a public meeting. One of the big concerns around pushing reauthorization is about the impact that the conversation would have if there's a focus on undocumented, the benefits that undocumented residents have under Ryan White. If that becomes the main line of opposition to Ryan White and to HIV/AIDS programs overall, that is a can of worms, and that you don't want to be fighting. That will take up all of the energy. And so while there's space to push for more funding, to push for adequate resources under the Affordable Care Act, to push for stronger support within HUD for the HOPWA office, those are things that we can actually win on. Those are things where the lines of opposition are not nearly as clear or problematic. There's less risk involved in those.
Great.
So yes, I think that's your assessment. I think is at its heart right on.
Paula?
But Kareem, ultimately, I mean, I can understand that maybe we might not want to push for reauthorization right now because of the reasons that you stated. But isn't ultimately the goal reauthorization? I mean, I know that we can still operate and receive funding as long as they fund it without it, but somewhere in all of that stuff, there's a reason that you authorize things or don't authorize things. And so we might be able to fix it for this moment, but do we make ourselves vulnerable down the line?
No. The answer to your first question is yes. Yes, this is something that we do not want to go away. And the answer to your second question is that by not pushing it now, there is no disadvantage towards pushing it at a better time, probably next year, next spring, I would imagine. One of the things that has to happen, I will say has to happen, if you kind of look at the sequencing in Congress, one of the things that would be beneficial is for the Affordable Care Act to roll out, to have any bumps in the road smoothed out, and then kind of basically prove that it's fundamentally working. And then making the case that this is a layer, Ryan White is a layer in to make sure that it's a layer of support within this new reformed, transformed system of delivering health and support and health supportive services.
So that's
So
more like 2 years
this
from
is
now.
not, it's not permanently tabling this. It's just making sure that it comes at a better time.
We have a queue now.
But we
Michael?
don't shoot ourselves in the foot by waiting. That's it.
Ms. Murphy, we have a queue of questions now, so if you can bear with us, if you have time, if you can hang in with us. Michael and Raina?
I do.
Okay, thank you.
I just want to reiterate, HOPWA, actually, the authorization that, the legislation that authorizes HOPWA has expired for many years. And this EMA has been, or Fort Lauderdale housing, whatever you call that, what is it called?
Metropolitan Statistical Area, or the...
Thank you. That we have continually received increases over the last several years, despite legislation authorizing HOPWA. The other thing is, as the documents are being prepared for you, many of the organizations are urging that while we're still trying to figure out actually what this Affordability Care Act is and actually what it means to people living with HIV/AIDS, all organizations are urging hands off on the program so that we could better assess where the gaps really are before we redesign a safety net.
Thank you, Michael. Marie?
So, Kareem, I have understood that this was sort of the thinking for a while. Can you help me understand why there would be a push to do something different at this point, and what appears like from one organization, but maybe from others, which I'm not aware of? Is there some other rationale that's behind this that I'm not understanding?
Behind the effort to push for reauthorization?
At this moment,
or
when,
the concerns-
when all these national groups are saying it's better to wait, you've sort of indicated that as well. Why is there a push to move it forward so quickly when so many different organizations are saying not right now?
Well, so what happens, let me just, I'll back up just a little bit and kind of just the picture inside of Congress. You know, for the last 3 cycles of reauthorization, we use the term in Washington, bicameral bipartisan. So Republicans and Democrats in the House, Republicans and Democrats in the Senate, all got together and essentially passed what amounted to the same bill. That was, they reached, the stakeholders put forward a consensus document each time, and the Congress responded in kind with, for the most part, pushing us across that line. So it's been relatively uncontroversial and a model for how Congress is supposed to operate. There was an effort starting late last year to do the same, and there was not a space for consensus. Republicans and Democrats in the House could not agree on what reauthorization would look like, and Republicans and Democrats in the Senate could not. So they started down a pathway for a breakdown, so that you basically have a really ugly bill in the House and a really pretty bill in the Senate, or you might get a really pretty bill in the Senate, and then no way or no mechanism to come together. To some extent, they didn't want to start going down a road where they were not going to be able to actually produce a bill. In the middle of all of that, you've got a big question about whether the Affordable Care Act marketplace is actually going to work. And the administration is trying to say, take a pause, let's see how systems of care operate, and then come back and say if there's a stronger, that may be able to provide us with data and information to make a stronger case for reauthorization. And so that's really, that's the kind of big picture backstory, is that if you kind of look at how the House of Representatives is acting right now, you'd wind up putting a target on our backs.
No, Kareem, I'm sorry, and I hate to interrupt you. I don't know if you misunderstood me. I understand all of that. I understand the concept and why groups are saying it would be better to wait. What I don't understand and what I'm having trouble with is trying to understand why a group would be pushing this forward at this moment when everything else seems to say wait.
Right.
Okay.
Can I just, yeah.
I have a very simple answer to that.
Okay.
I don't know.
Then we're in the same spot. Great.
Okay.
Thank you.
So,
I have no idea.
Mr. Green and
Right, and I don't think we should really try to get in the head of other groups. You have information in front of you to make the decision you need to make.
I
Because-
didn't know if there was, so I understand the information that was presented as to why to wait. I did not understand and have not seen why we would want to move forward. So I was asking, is there information as to, so if all of this is true, usually there's two sides to debate. I don't understand what the other side of the debate is, and I was hoping to get some, this is a logical reason, and so.
I can give you a 30-second counterpoint.
okay.
Right,
That
you
is,
make-
some people think that there could be a rider attached to a bigger bill, like whatever's going to happen with debt ceiling or immigration or funding for moving forward, that wouldn't have to have the long debate, that could reauthorize it. There are some that think, however slim that chance may be, and it's getting slimmer with the insanity over what's going on with everything right now. And then the issue of the hold harmless. The South is disproportionately impacted. The funding is protected in older epicenters where it's staying there. And there are people that want that hold harmless to go away because the epidemic has changed. So that's the other side of the argument.
Mr. Murphy, are you available to hang on? And we have two items that are coming forward. And if you could be part of the discussion when we have this motion, that would be helpful.
And you know roughly what time that's going to come out?
It should take us 20 to 30 minutes. 20 would be short.
Okay, what I may do is just dial in from my mobile phone if that's going to be acceptable for you.
Members are comfortable moving that item up?
Let's move those items.
And are you available now? We can do that now. If you're available now, we'll move it up. Are you available
Yes.
now? Okay, does members feel
Yes.
comfortable moving this?
What item are you referencing?
I'm sorry. It's discussion item number 21.
Where is it? Is this
At the very bottom of the allocation sweeps, you'll notice it's just underneath.
Mr. Chair, if I could just respond to Louise, I'm sorry.
Just 1 second. Let's just get everybody on the same page and then yes.
Does Kareem have it?
Green, do you have our motion that's coming from executive?
I do not.
Can we
The
send
only thing I
that?
have on my screen is just the
Can we-
update that I sent.
Can we send that in an email to Mr. Murphy? And while we're doing that, is there a motion to adjust, I guess, our agenda to move this motion forward first?
I made this motion.
Okay. Made by Mario, second by Brad. All those in favor, sing by saying aye.
Aye.
Any opposed? Okay. So what we'll do is, Michael has one question for Mr. Murphy, and then we'll move right into the motion.
No, my comment was just to clarify, and it's an observation, I'm not making an accusation, but it's a mere observation from somebody who looked at this from a business standpoint. But, you know, Ryan White is certainly a program that AHF as an organization particularly engages and contracts with and provides services. So they're trying to make certain possibly that the program most benefits them as an organization that engages in those services and has in a bubble or silo created what they see as the best policy recommendations for what could be. What they are doing, which we could agree with, is more money comes to Florida. However, I think as we see changes in the Affordable Care Act and as Ryan White transitions possibly to a insurance premium, like an AICP, you'll find that there may end up being more money coming to Florida, or that money may actually not be needed as robustly. So things could always change.
Okay, thank you. We had some new members show up since introduction, so if we can do that first, so we have it for the record. Any conflicts? Thank you. And Anya?
Hi, I'm Thornberry, Broward House.
Any others that? No. Thank you. Okay, so motion or discussion item 21. Do we need to change that to make that?
One?
It's discussion directly to that item.
Okay.
My turn? No.
Well, I was just going to explain where it's coming from and
Oh, okay.
why it's there. If you could just give me 1 second, and then we'll go to that motion. Okay. So does that become discussion number one now? That's my question.
No, it stays 21, we moved 21 up, everyone voted on it, it's now the item that's on the floor, you've had a motion and a second, so this is the appropriate time for discussion.
Okay, thank you. Okay, so this motion is coming from executive. Executive met last Thursday. The grantee brought this concern to the executive committee. We had a lengthy discussion, and we thought it was appropriate to take action. And we thought it was kind of unfair to come to this body without some type of motion or a starting place, a template, rather than do that work here. So this motion is built meant to be a template to be built on. We can tweak, we can make changes as we go along to make them stronger. We heard some discussion earlier. So this is a starting place. I just want you all to recognize that's where it's coming from executive. Our intent was that we agree that the CARE Act is important, it needs to be funded, and we were giving some guidance for our commissioners on this body. Okay. Will, did you?
Sure, yes, thanks. Joey's question was, the one that I answered was, what surprised me most was, where is this conversation that we've been having for the last 10 or 15 minutes related to an item in the agenda? I was at executive when this motion was drafted, but it was not at all related to the discussion that we just had. It was at the urging of the grantee, who asked us to respond for the purpose of the commissioners understanding and clarifying our stance on reauthorization. So I read this, and I was present in the conversation, but I read this, and in its basic black and white language, there's nothing in here that's controversial. There's nothing in here that's different than anything we're saying. What we're all saying and what's just been discussed is that we would like to see reauthorization, and we would like to have full funding of the HIV continuum of care. But I would be reluctant to have us pass this as a response to the conversation that was just ensuing. And frankly, given that all members were not provided information which was intended to be shared, I would like to table this motion until we have such time as information is properly provided, and the meeting, either later in this meeting or at another meeting, the council can fully decide with the full disclosure of information about what the genesis of this motion was.
I second that motion.
I need a second for the table, thank you.
I second that motion.
Okay, so it's been, motion's been made, it's been second. Discussion. Mario, and then Michael. Mario?
I agree with the statement. My concern is when we take it to the vote is how do we communicate this to both the county commission and the city commission so that they understand that maybe we need to do a white paper. I don't know what the answer is, but I think we have to, we have to have a follow-up to whatever this vote is about what we're going to do next. Because since there is a gap between now and our next meeting in October, you're talking a 4-week gap, and God knows what will happen in that time. So, not only do we need to vote, then we have to say the next thing we need to look at then is, now that we voted, whichever way we vote, then what's the stopgap measure to notify the city and the county commissioners of what we plan to do, what our course of action is, and what we plan to do to get to them, and when do we plan to get to whatever we need to get to them.
Michael?
I would ask for an amendment to the motion if the sponsor would do so, and that was to also maybe call for us doing a town hall to engage all the Broward stakeholder population and people living with HIV/AIDS in this dialogue, and to also establish a work group that would convene very quickly after to then bring its recommendations to the next planning council meeting. I also need to note that I was in attendance at the Fort Lauderdale City Commission. I did speak at the Fort Lauderdale City Commission as what Commissioner Trentalis termed as anybody who opposed AHF was a rival faction, which included Jasmine Shirley and several other community individuals such as Francois LeConte, Fritz Clary, and several other people who have engaged in, and Dr. Rosalind Carter, who all urged, please hold off on this. So there is a broad-based community stakeholders that are urging, this is the wrong, AHF is urging and forcing the wrong position in dialogue in this matter. So I don't know if the sponsor of the motion would so entertain, because I think that really complements and furthers the dialogue that we all believe that we should be having. So I know that when ADAP had a crisis, we were all, our panties were in a knot at this table for never having that dialogue. And I think that this is a really just, a bad, I thank you for listening to my concerns and taking action on that. It's been many, many months since I've been back here. And I had reservations of coming this morning, and I thank you for listening.
So I'm just going to ask.
Point of order.
Point of order.
One
Point of
second.
order, you have a motion and a second.
You need to move on
You
it.
need to move on it, thank you.
Are you?
You need to take the vote on the table of the motion. I made a table to the motion because I don't feel that we as a council have all the appropriate information to make this decision today. There are a lot of good ideas that the two prior gentlemen have mentioned, but I have a motion and a second for a table. That is what we now discussed.
Okay. All I was going to say was I feel uncomfortable with naming providers. So I'm going to ask members of the public, please do not name providers' names. That's that. I was just going to ask.
Members of the public can name providers, and it was actually a motion I rivaled against.
I'm just asking. I just feel
Vice Mayor
uncomfortable, and I'm asking.
Many years back when I first got on the planning council as an alternate. So I'm well within my rights and guidelines of the council.
I understand. I'm just asking. That's all.
So,
Okay, so the motion's been made. It's been seconded.
so to discussion on this motion about table.
There's no
There is no
discussion on
discussion
table.
on
This
this.
is a vote on whether we table the motion or not.
Continue discussion.
So we all clear? Okay.
So wait,
Okay, so let's clarification only on what we're voting. We're not discussing what the motion
All we're
is.
voting on is what I mentioned, which is I didn't feel that I or other members of the council had appropriate information, so I asked to table it to a later time. That doesn't end the discussion. That
have
allows
more?
for future discussion with all of the input from all of the voices. That's what we're voting on. Do we want to make a decision right now here, or do we want to move this thing to a date when we have more information and more time to consider?
Are members clear on what we're voting on? No.
Move it to,
Voting to table.
Third box, number 1, on the back of your thing.
take it easy for a second. I need the over 40 girl. Are we moving this later today, or are we moving it later, later when?
It can be later today, the discussion can continue. What I wanted to do was take the tenor of the exact motion that's there that causes some people to say, I do support it and I don't support it. Let's get rid of that vote because it's clearly not enough information, and let's work today, let's work tomorrow, let's work in the future on crafting exactly what it is that this full council would like to do.
Okay, all right.
Are we clear on the motion? I've asked. Do we need, okay, it's up on the board.
You guys see this? Table session item for any further information?
Okay, so we're going to be voting. All those in favor of the motion, please state by saying aye.
Aye.
Any opposed?
Aye.
1 for the record. 2 for the record. Thank you. Okay. So this whole discussion has been tabled. It was made by Will Spencer, seconded by Rhonda Reed.
No, we're not talking about it at this meeting.
We'll talk about it later. Third box, number 1. Tell them, Joey.
Thank you, Mr. Murphy. Appreciate it.
Clear what
Thank you.
later.
You need
For
your
of my assistance in deliberating on this, I'll make myself available, okay?
Thank you. As always, we appreciate it.
Thank you, have a great day, everybody.
Thank you.
You too.
Okay.
So, can we make an informational request to staff support saying we want the materials for both sides? So everybody's got both components of this. And then, I guess the discussion during the meeting so people can see, like I wasn't at the meeting, I have no idea how this happened.
The organizer has ended the session, and this call will be disconnected. Goodbye.
Well, that was direct. But that way everybody can see, okay, context of this.
So it sounds like if we were to take action, it would be at the next planning council meeting. So what material, what type of steps, our workshop, where is our plan to be able to take a vote at our next meeting? That's what we're doing, right?
Well, I guess the group would determine that other stuff. I'm just saying the informational stuff that's already on record that everybody needs, and that can be emailed out to the council members. But if people feel you need more than that,
Okay.
there needs to be a discussion.
So we'll put a request in to support staff to provide us with the information, discussion that's happened in the community already, to provide us as members that information. It's been recommended by the community to do a community forum. Is that our wishes, to get the input of the community? Mario?
I think we still need to draft something to the commissions to let them know that we don't have an answer. We're working on the answer to get consensus from the community as well. And we hope to have an answer by through this process, so that they know what the group has decided to do to make sure that whatever comes forward, there's been enough discussion, informed decision, and community input. And they need to know that. So some kind of letter needs to be drafted to both commissions. What is the plan to take it forward so we can give a good response to this?
Leonard?
So when I brought this forward to executive, I basically gave a brief background of what happened in the community. Basically asked the council to put on the agenda to weigh in on their thoughts about reauthorization. Now, there were some other things that Michael brought up that were not in my discussion that you may want to consider, but the ultimate goal was for this council to make as being one of the sole benefits of the CARE Act, to make a advisory statement on your stance on reauthorization. So that was the discussion that I had with the executive. So if you guys want to take it a different way, you want to say, hold on, let's have a town hall meeting, let's get the whole community, that's fine. But I just want to kind of give the genesis of how the discussion happened with executive.
Thank you. And additionally, on the Part B side, after the city commission, the mayor asked us to have a forum, and so we had some participation at the Southport AIDS Network Consortium meeting. We had a group of people get together to revise the language that was there to be more inclusive, more accurate, more information in it, and we sent that information back to the mayor, and I'm not sure if it went to the county commission or not, but that information from that work group, I wasn't a part of it, but that got forwarded back to say we did have some level of interaction and participation, and forwarded that back.
Mark?
So from that session, can I sort of be sure that I have this clear, that according to Kareem Murphy, that his suggestion from where he's seeing this is not a good time to support reauthorization of the act, not because we don't support the authorization of the act, just that the timing is bad because what else is going on. Is that clear? Do I have it clear?
Yes.
Is that clear what
Yes.
I'm hearing? Okay, I just want to be sure. Okay, thanks.
Okay. Michael, and then I think we need you in action from there. Michael?
I just want to say, and Joey, thank you also, because that was it was a small work group. But what I will state that during conference committee of last week, during the Fort Lauderdale City Commission, Commissioner Trintalis basically stated that the room, meaning the work group, was dominated by HOPWA providers. In that room sat Jason King, not AHF, not a HOPWA provider, Michael Rayner, a consumer and somebody who doesn't get paid to do anything, or even a HOPWA recipient, even though I could use it. And Jasmine Shirley, who does sit on the board of Broward Regional, who then has a relationship with HOPWA, and obviously the HOPWA grantee. And then on the phone, Donna Sabatino, and I don't know when Tibotec or Anak had started to provide HOPWA services. That would be shocking to me. At Rick Siclari, who was not on the calls or participated, but signed up to be part of the work group, who, yes, Care Resource does have a relationship with HOPWA, and George Kress of Walgreens, who certainly is not a HOPWA provider. I do have the video commissions meetings and all the relevant dialogue without any commentary, strictly straight from the public record, extracted from the video of the City Commission that I downloaded to YouTube. And I will make those available to staff if they can circulate those. There's nothing that has been tampered. It's the full dialogue from beginning of discussion to end of discussion from all three meetings of the Fort Lauderdale City Commission, where you could actually witness the dialogue. Joey testified, I testified, Jasmine Shirley testified. And I found it really offensive that AIDS Healthcare Foundation would characterize input from community stakeholders, especially PWAs who rely on this program, as bipolar arguments, including from Jasmine Shirley, as a bipolar argument in this, at that city commission meeting. I certainly hope AHF doesn't provide mental health services, because I know that there is a big correlation with our consumer population, and I would hate to think that they would be stigmatizing individuals with mental health issues.
Okay, thank you, Mike. Okay, so going forward, I'd like if we can have discussion about a plan, action plan from here and with motion. So, Rhonda first, and then Joey. Rhonda.
I think I wanted to call the question, but I'm not sure
There's
where
no
we
question.
are. Okay, then.
What I wanted to say, especially for some of the newer folks, is by us starting this now, this process will probably take a year. So even though we're talking about what do we need to do and what we're going to do, because of how things play out, it'll probably be a year before we have an end product. And that's why we need to start thinking of, we come up with documents, we come up with town hall forms, we've got to summarize them. That's going to take a long time. So even though we sound like we're starting to do this now, by the time it all finishes and meetings are done, it'll be a year from now when we need the final results. So that's kind of what's going on in terms of how we move forward with what do we do with reauthorization in an Affordable Care Act environment.
Thank you.
In terms of action steps, because I agree with Brad, that's where we need to go next. Fortunately for all of us involved in the A and the B side of this equation, we have a joint executive coming October 17th, and I think it's appropriate that when you have both your consortia and your council in the same place, in the same room, that provides more than enough time for sharing or dissemination of any additional information, be it media, print, or otherwise. And then October 17th, the joint executive, this could be one of our first agenda items.
Is that a motion?
Yes, that's a motion.
Is it seconded?
I second.
I'm sorry, Brad. I heard your voice over here for some reason. Any discussion? Okay. Call it, and then Leonard.
But actually, I have a motion, I guess, to piggyback on you.
Okay.
That we, I don't know what we call it, but some type of putting the Fort Lauderdale Commission and the Broward County Commission on notice to, or recommending that they don't vote on anything until they get our recommendation from us, and kind of like you say, time frame out what we're doing when we anticipate having a response.
That's a friendly amendment. It's accepted. The idea would be that we would advise them and invite them to join our discussion and join executive on the 17th.
Like a continuing resolution.
Leonard, if I can ask if we can get this on the board so when we do vote. Leonard?
So, let me
Tell them
also
don't do anything.
one of the reasons I kind of brought this forward is we're talking about the City of Fort Lauderdale resolution. There was a City of Fort Lauderdale resolution. At one time, there was a resolution put before the Broward County Board of County Commissioners that was pulled. And so one of the things that I wanted this body to do is to make some type of comment, either or. Now, if you say, because there may be a potential resolution coming up, and so if you're silent, then this body has not spoken on any potential resolution or whatever. So my thing is that you have say in what you believe the process should be or what the statement should be.
Thank you. Rick?
So I guess I'm just, I want to be clear, because I was a part of the working group that was supposed to massage the original resolution. Now I'm talking about the city commission. And then I wasn't able to make the meetings, and for the record, it's because I was at another meeting, and nobody told me about our working group meeting until Michael called me and said, we're meeting now. Anyway, but all that really was. My point is that we need to be clear about the fact that the city commission thinks that the participation, I believe, Joey, correct me if you think I'm wrong, but the city commission believes that the SBAN participation was the community input they needed, and then our process after that in recrafting the resolution was kind of it. Because I was part of the email back from the mayor to our working group saying, congratulations, I'm glad you did this and got all this involvement. And, he's very congratulatory of us and our efforts. And so I just want to make sure people are aware that at least from the city commission point of view, I think they think this is done, and I'm not sure how much they're thinking the planning council has any reason to weigh in. The county commission, I think, is a whole different thing. So I would just separate those two, because I'm not sure where that process is. or how we can slow that train down.
Okay, so I'm going in order. It's Michael and then you. Michael?
I just want to remind, as part of this, also, the city commission was under the impression that the community was going to be hosting a Ryan White town hall meeting that was well advertised, well, it was advertised at least in a gay publication. I don't know if any of the other community publications in the Hispanic or Black community were advised, or the Caribbean community in a language that was culturally appropriate. But I certainly would say that town hall did not happen actually as well. So I think that the messaging, that was never reported back to the city commission that that town hall was postponed, nor was the county commission given the impression. And I really do think that, we all work best when we're working together to share ideas to come up with a real consensus statement of stakeholders.
Thank you. Joey?
I think the mayor's expectation for the city, because the city doesn't really carry this message, was that the county is going to do much bigger, broader, more intense. And the expectation was they will probably have town halls and much more on this because the city doesn't typically take a lead on CARE Act programs. And that for their purposes, for that resolution, whether they up it or down, it was at least this one effort at SFAM, because I did see him say, yes, we did do it, and then we got the email back and forth. I think for their limited purpose of having a resolution on record, that was all they wanted because they weren't really going to invest time in CARE Act activities.
So, I apologize. I know you're the commissioner staff. Can you introduce yourself for the record? And also, I know you have a question or a statement.
Scarlett from Commissioner.
Please come to the table and join us.
I'm taking notes, and I just wanted to share with you that whatever the will of the board is, the commissioner will support that, so.
County commission.
County
We're talking
commission.
about city too, so.
County commission, so I know you're trying to work through exactly what your position statement will be, so as soon as you finalize that, he has no problem supporting what the will of the board is.
Thank you. Thank you. And thank you for attending. Mario and
The only thing that I would say, I don't want to use the word disturb, but that's what it is for me, is that this was such an important thing to be pushed through. And I'm new to the council. I'm learning how you guys do your stuff here. I don't understand why this kind of resolution was not discussed prior to any action being taken.
so we're not clear what the motion is.
To the political. And that's my concern, is that this resolution, resolution happened, and since we're the governing body over that, we were, no?
No, we are not directly connected to the city commission.
No, I'm talking in general. I'm talking about forget about city, forget about the county. In general, you have this kind of resolution going through, who's trying to get to the county at the same time, parallel tracks, and somehow this kind of resolution was put forward without the input of the group. And that's my greater concern, is that in the future, when these things kind of happen, the organizations out there should be working with the group to get it to go forward, not to take it on their onus themselves, because then you get a disconnect and you get this kind of what's going on right now. That's all I'm saying, is in the future, all the organizations, I approve of advocacy. I think it's a great thing. But at the same time, you have to work with all the parties involved, because this is what happens when you do not do a collaborative or integrative process or interlocking everything with everybody. That's just a comment for the future that on this whole thing.
Thank you, Mark. Before we go into question, if we can read out the two motions so everybody's clear where we're at and bring us back to the motion.
Apologies.
No, it's fine. Thank you. We're on the motion right here. And if somebody can read it, please.
Okay,
I can't say it.
so the first motion, wait, you want to read it?
Just the motion.
The two motions.
Discussion item number 1 for a later date pending further information. And the second motion is to include
Discussion item number 21.
21.
Pardon?
Excuse me.
Wait a minute.
Excuse me. That motion that says to table discussion item number 1, we just brought 21 up first, and we kept it as 21, not 1.
Just the 21.
Yeah, it's 20. Yeah, we tabled 21. Then Will made a motion. Can we have Will's motion up, and then we had a friendly amendment to it from CALA. Can we have those two up?
That's it.
Yeah.
That's it.
Okay.
That's it.
Okay. Okay. Will?
Can I just echo on the motion that I'm sort of completely concurring here? The idea is that discussion and debate and whatever ensued, and then afterward, the Part A council was asked to weigh in on it. But we were not voices during the discussion, so the reason I asked to table the motion was to allow for that process to happen. Collaborative will get us there. And I would go further in that the commission should not take action, but I would, as opposed to that, we can't tell the commission to not take action, but I would invite the commissioners or any other interested parties to come to our joint executive meeting to participate fully in the discussion.
Yes.
Yeah, but that would be, I don't think we should tell them you can't take action,
Mr. Chair?
because I don't think we can.
Can we just make those changes first?
I think he-
Is it county commission?
County commission,
Thank-
yes.
I put in there because we've had the city
Yes.
and the county.
Invite them both.
I would be more specific.
Invite them both, though.
Yeah, that's fine, but be specific in there so we know what that means. The county and city commission is what I would put there.
I just wanted this clear. I just don't want.
Thank you.
So you do not want this first line, is that what I'm understanding?
Can we just say delay action instead of not take? Because I don't think we have the authority to tell our commissioners what they can and cannot act on.
Yeah.
It's not our job. We're not trying to get them to not do something.
Advisory to them, not the other way
Or recommend to the council to delay
Right.
action.
We want them to join the
Recommend
conversation.
commission
Okay, Michael and then William.
I just, Will, to your point,
Yeah.
well, the word you can't tell
Right.
would not be the right word, but this as an advisory body to the board of, the Broward County Board of County Commissioners, it is actually your duty to provide recommendations to the Broward County Board of County Commissioners. So you are well within your right to send any recommendation as it relates to Ryan White Part A programs or other programs or any issues that intersect and relate to the issue of HIV/AIDS that affect people in Broward County. So you can clearly, it can be, yeah, exactly. HIV PC can recommend to the commission to delay action on this topic.
Please put
Would be
county though,
inappropriate.
because it's,
County.
put county.
County and Commission. William.
On the top.
Well, I think, just to your point,
Say it
Joey,
again,
the
County.
only body you actually provide recommendations to as
Doesn't matter, we've got
within
city,
legislative
county,
intent
I
of,
want to clarify.
Okay, William.
but that's fine.
Right. I just want to point out something. Whatever the will of the body is the will of, it will be the will of the body that goes back to the commissioners. But you have to be very clear in what your statement is. For me, just reading this is not clear. Try to be as specific as possible as to what you're trying to relay to them so that there's no ambiguity and there's no question regarding the intent. It is not clear why you're saying delay action. Why are they delaying action? Do you have an issue with the way it's being processed or the dialogue that's taking place? Okay, and if there are time frames, you need to be clear about those, and of those time frames.
Maybe that would be the justification,
And in regards to
right? Do a
communicating to the
justification.
city of Fort Lauderdale, you report to the Broward County Board of County Commissioners. They will have to communicate to the city, not this body or not my office.
So why don't we do this, because we do it in priorities, is justification of the motion. And then a lot of what William just spelled out, we can put in the justification for this motion. So it's clear. Are we, is that, and then the commission?
I just wanted to agree with your point as far as with bringing back information to the commissioners. It's a body of 9, so it's specific you give me. It helps them with their interpretation of your recommendations so they can make a thoughtful, clear, concise decision when they're having discussions on the matter. So bullet points and exactly what your, anything to support your recommendations as to what your position is would be helpful.
Okay, so why don't we work on that part, Joey?
Yeah, my question, I guess, to William is, have they even started the process yet for their reauthorization position statement?
Well, first,
Because I don't want to say delay if they haven't
Yeah.
even begun to
yeah,
formalize.
what happens is we do a federal legislative package, which this will fall under, We did a federal legislative package last year, and at the time when we offered support, the recommendation was for support of reauthorization. It was included back then, and I guess it was the 2012-2013 legislative package. But that was based on a different environment and a different set of situations at the federal level. We have not developed the 2014 federal legislative package for them.
So I would ask the language not be delay it, but we'd like to spearhead that reauthorization process in terms of gathering community input. Because they haven't started it yet, we don't want to start on a negative tone and say delay what you're doing.
So Joey, can you put that towards a friendly amendment so that the author can...
For them to continue to gather, for them to continue their process of gathering information and thoughtfully consider all the information before the recommendation is finalized.
Friendly amendment?
I'm trying to think of wording, because the delay is a negative, and so how do we flip it around to be a positive?
Will?
Perhaps the HIV Planning Council requests the county commission include our input related to this action, related to this topic. But that way we allow ourselves to be included in it rather than asking them to delay. Because I agree. So the idea of telling them no, don't do it, or delay isn't really.
But I
our
thought
role.
that there was a pending motion before the county commission
William
concerning
clarified
this.
that.
But there is not.
No, he just clarified that.
We have not seen the commission agenda for Tuesday. We will get it late this evening, but even then, I think that sometimes you can enter a last minute item, so I'll just say that. But the commissioners had a recommendation.
Could you...
Replace
Can you please come to the
language
table? Why don't you join us at the table, please? Thank you. Thank you.
Okay, you have to fill that.
And instead of on this topic, the topic is Brian White reauthorization position statement.
Yeah. That's exactly how it's done.
Okay, Will? I think you were next.
And then can we, because again, to William's points about being more specific and helping to clarify what we're doing and what our process is, if we go a little bit further, that first sentence is great because it's now much clearer. HIVPC requests that the county commission defer action on the topic of reauthorization of the CARE Act until such time as the council can review and recommend a plan of action. Invitation will be extended to the county commissioners to participate in our joint executive meeting on October 17th with the opportunity for ratification by the full council. Is it the 24th, 1 week later?
You lost me at council.
Sorry, I can say it again, but no problem. Does everyone follow me though? And then that allows us for an opportunity to begin this, to gather data in between, to have conversation, and then to finalize where we are. I'll do it one more time. HIV requests that the county commission defer action on the topic of reauthorization of the CARE Act until such time as the council can both review and recommend a plan of action.
Can I offer?
And then, sure, yes.
Will? I mean,
Okay, Commissioner Holness is the representative to the planning council, so if any invitation, he would come. So I would suspect that the commissioners would expect that you do the work and it communicated via Commissioner Holness. And he supports it once it's on the dais, and he will lead any kind of discussion around it or direct me if I'm wrong.
I would agree, but I would suggest you extend the invitation to all, even though he is the person for it, but I mean, the more you do, the better, more people can advocate for the cause. So if you extend it and if the others aren't able to attend, at least
And correct me if I'm wrong, it would also help Commissioner Holness to further this if he had other people who understood the context from which this advisory body.
But I think what William is saying is that it needs to, that invitation needs to be coordinated through through Commissioner Holness, because he is our representative
Right, and
in
to
this body.
actually acknowledge his
Right.
seat on
Right.
the council, I think is a good idea.
And October 17th is out of Tuesday, right?
It's Thursday. Michael?
I would just like, it's a matter of public record, it's a communication I received from Commissioner Tim Ryan's office last night at like 5:05. But I just, so that while Mr. Green has stated that county staff has not actually seen, or that it's not posted to the agenda, just to add some truth to the fact that this will be, Commissioner Ryan plans to have this resolution back on the agenda on Tuesday. It will be the same language that was passed by the city of Fort Lauderdale. The county attorney has asked for some additional questions and would like my assistance. But at that point, I would actually not, I've already communicated to the Commissioner's office that I am not in support of that resolution, and nor will I be assisting in providing clarification to the Fort Lauderdale resolution.
Go ahead, Bob.
Staff, sorry, the last sentence was the opportunity for ratification by the full council will take place 1 week later at the regularly scheduled HIV Planning Council meeting. And that says to the commissioners that we want you to hold off and gather some information on this. You're welcome to come be a part of the conversation with us, and 1 week later we will deliver you our statement clarifying our stance on HIV Planning Council Part A reauthorization.
So will you want that under the part where we, on the October 17th?
Yes.
Or
Yes, absolutely.
press under?
Because I want them to be clear that the discussion will ensue on the 17th, and there's an opportunity for the full council to ratify it
Press enter to start writing.
on the 24th.
So basically, the recommendation will come 1 week following? Can you just repeat that one,
Yes.
please?
An opportunity for ratification by the full council will take place on October 24th at the regularly scheduled meeting.
Ratification.
The full council will vote on this.
But you can't guarantee that they will, so I'm saying that it's the opportunity.
It'll be
is.
coming
You
up
can't
on our
guarantee
agenda.
that the council will vote.
Okay, so the opportunity for
I say
ratification
that from experience.
Well, that's true, because we haven't even got to our agenda
Right.
today, so.
That's what I'm,
will occur.
an opportunity for ratification by the full council will take place. It's not of this issue. An opportunity for ratification by the full HIV Planning Council will take place on October 24th. And that basically says to them, from now until the 17th, we can gather our information and share it. On the 17th, we're going to have Part A and Part B and anyone else interested in the room to discuss. And a week later, the full council will ratify that motion.
Second.
Or not.
All right. So the motion was made by Will. It was seconded by Ron to read. Are you comfortable with that? Still seconding? It was friendly amendment by caller. It's all your in there?
Well, that's Will's friendly amendment, isn't it?
No, well, originally was yours.
Himself.
Uh-huh.
Okay.
Works for
Work in
me.
progress.
Okay, so we have the motion, it's been seconded.
Take out a curve.
What are you gonna ratify?
Take out a curve.
Hopefully on the
If the joint
24th.
executive comes up with a motion, which is what we tabled today, so that we can get to it on the 17th, then the full council would ratify that decision.
Just be clear, you will develop a recommendation.
That's what it says, until such time that we can both review and recommend a plan of action. So that's exactly what it says we're doing.
I still like vote better than ratification.
Okay, you can say vote. Ratification is what occurs here, but you can call it a vote, whatever you want.
Do all the community meetings and all that, or you're not gonna bother with
That won't happen before that meeting.
We won't get all that in before the.
it? So you're gonna make a vote and all that without community input?
It's a vote on how to build the process that we're
Yeah.
gonna use over the upcoming year.
In other
On the
words,
24th, we're not going to make a recommendation that's going to say
not
authorized or
finalized.
not authorized. What we're going to recommend on the 24th is, this is the plan. These are the community forums, if we're going to do town halls, or whatever that looks like.
to accomplish what we,
The plan to gather input.
The plan for the plan.
Can I,
Plan for the plan.
can we make one
Ma-
clarification statement where it says, first paragraph, plan of action on form, I'm not too sure the verbiage there for the reauthorization, because then I think that goes back to what you're saying is, we're not gonna come back with reauthorization, we're gonna make a plan of action for addressing, I'm not sure what the verbiage is.
Reauthorization position statement.
Yeah,
Because that's the ultimate goal.
That's what you're gonna get at.
I just want something more, a little bit more specific there, so then the commission knows exactly what we're gonna be doing.
Okay, so we have a,
I don't want to leave it up to ambiguity.
For the community.
As long as we're all coming to the table, sharing our information, getting a chance to speak, and then reaching some consensus and moving forward, I'm all for whatever words you guys want.
Are we good?
So we
You
can
good?
I can
Yes.
call a question, we can do this.
Yes.
Okay.
okay, motion then call the question.
Yes,
So,
Call a question, just go to the vote.
Jesus.
everybody's comfortable? Okay. So it's been moved, it's been seconded, we have lengthy discussion. All those in favor of the motion, signal by saying aye.
Aye.
Any opposed? Hearing none. Passes. Thank you, everyone. Thank you. Stay.